right, starting next week, people in England will no longer be required to wear face masks, nor will they be required to work from home. British Prime Minister Boris Johnson told members of Parliament yesterday that in light of the data, I guess that would be the science, the country's Plan B COVID restrictions will expire next Thursday, January the 27th, and that the government will trust the judgment of the British people. What a novel idea. And the UK is not alone. Other countries such as Spain, Portugal, and others are looking to switch to a different COVID-19 game plan, which means freedom. Will more follow suit? What about the U.S.? Here to talk about the direction other countries are headed is Dr. Bhattacharya, who is the professor of medicine at Stanford University and one of the authors of the Great Barrington Declaration, a statement advocating an alternative approach to COVID-19 pandemic. Dr. Bhattacharya, welcome back to the program.
Thank you.
All right. Can you tell us about some of the approaches to COVID that internationally that we're seeing now that are catching your attention?
Well, the news out of the UK is absolutely stunning. Essentially, what's happened is that they have realized that all of these policies that are aimed at slowing the spread of COVID have failed. That in fact, COVID is a respiratory disease that spreads very rapidly, despite our best efforts to keep people apart from one another. It spreads, especially with Omicron in particular. It spreads, and the right response then isn't to try to stick your finger in the dike when the flood is coming over. The right thing is to protect vulnerable people while letting people who are at low risk from severe disease from COVID, which is basically most of the population other than the elderly and some folks with chronic diseases, to just go on with their lives while still working to protect the vulnerable.
Dr. Bhattacharya, it appears that the U.S. is taking a different approach, while other countries, and Boris Johnson, in his comments yesterday, said we're going to allow the British people freedom. We'll expect them to be personally responsible, but we're going to move toward greater liberty and protecting that going forward with policies. Here's a clip from President Biden yesterday at the press conference when he was asked about a changing definition of fully vaccinated.
Even some of your own medical advisors say that people aren't fully protected unless they have that third shot, a booster. Why hasn't this White House changed the definition of fully vaccinated to include that third booster shot? Is it because the numbers of fully vaccinated Americans would suddenly look a lot less impressive?
No, it's not that at all. It's just this has become clearer and clearer. And every time I speak of it, I say, if you've been vaccinated, get your booster shot. Everybody get the booster shot. It's the optimum protection you can have.
Is that what the science tells us?
Well, let me just say, I think it's more than just a medical question here. The whether you're fully vaccinated is now linked in many states to mandate policies that you have to be fully vaccinated in order to keep your job, in order to be able to go to restaurants, to museums, to libraries. A lot of states and cities have implemented policy that essentially make people that are not fully vaccinated second-class citizens. To then turn around and say, okay, you have to get the booster to get this, essentially creates out of instantaneously with a snap of a finger a large class of people, based on the policies the Biden administration has pushed, turned into second-class citizens. So I think it's more than simply just a medical question.
Did he answer that question, though, yesterday? I listened to the press conference, and I wasn't sure that we got a clear answer from the administration if they're going to change the definition.
No, they didn't. They didn't give a clear answer. The protection that the booster provides against Omicron is less than the protection that it provided against Delta. Now, I do believe that there are people for whom the booster is the right medical decision.
Right.
And so for that, I think, I don't have any. I don't take any. I'm fine with what President Biden said around that. But I think the key question that he was asked, what is the definition of fully vaccinated? He did not answer. And it's because it's not simply a medical question. And by evading it, he evaded the central issue. Why are we still having these policies, these mandate policies that keep people out of regular life? It doesn't make any sense. It's just created harm without actually advancing public health.
Especially when you see European countries that, historically haven't been so protective of individual freedom as the United States have. It seems like it's like upside down.
Yeah, I mean, there are still some countries in Europe that are still have these, like Austria, and Austria actually made a policy where if you were unvaccinated, you weren't even allowed to leave your house for a while. It was a crazy policy, but much of Europe is starting to open up. Especially the UK is leading the way. There's no reason the United States shouldn't be leading. And of course, there are states in the United States, Florida, Nebraska, a few other states and Virginia most recently, that are starting to open up and lead the way out of this pandemic. But the federal government has played has continued along this sort of failed strategy to try to stop the disease from spreading at great harm to the American population.
Dr. Bhattacharya, there's a study that came out from a U.S. study, I think it was connected with the CDC, showing that previous infection of COVID-19 was actually better protection against the Delta variant, which was a very significant variant, than those who were vaccinated alone. Are we going to see the CDC start to factor natural immunity into their equation?
I would hope so, because the scientific evidence on this is absolutely overwhelming. If you recovered from previous infection, you have very substantial protection both against reinfection and also against severe disease. Yet we've ignored that fact. Even in the press release around this study published by the CDC, you could see how reticent the CDC and public health folks were to acknowledge this basic fact, because they're afraid that if you realize that you might not want to get vaccinated. Well, I believe that the right way to tell people about scientific evidence is to tell people about the scientific evidence. Yeah. Don't use it to manipulate people.
Treat them like adults. Give them the facts. Let them make the decisions.
Yeah, exactly. And I think you continuing to see the CDC use science in service of an agenda that they have about whether it's vaccination or social distancing or whatnot. The goal shouldn't be to manipulate people to do what you want them to do. The goal should be to provide people with good evidence so they can make good decisions in their lives.
Because that will have long-term repercussions way beyond when we have forgotten about COVID. That will still be around.
Absolutely. I mean, public trust once lost is almost impossible to get back. And public health relies on public trust.
You're right. Dr. Bhattacharya, I've got to leave it there. Thanks so much for joining us. Always great to talk with you.
Thank you.
All right.